Nyhus classification. According to Nyhus classification, there are 4 types of hernia. So see the types. First, what's the type 1? What's the type 1? So in type 1, patient is having indirect hernia and the internal ring is normal. But what happens in type 2? There is indirect hernia with enlarged internal ring. So type 1, here there is indirect hernia with normal internal ring. Normal internal ring. And what is type 2? In type 2, the patients are having indirect hernia with enlarged internal ring. There is enlarged internal ring. In type 3, patients are having direct hernia. So what happens in type 3? Type 3, when the patient is having direct hernia. Type 3 is further divided into 3A, 3B, 3C. What is type 3A? Type 3A is direct hernia. So see, type 3A, this is direct hernia. Okay, and now see what is included in type 3B. In type 3B, if there is indirect hernia which encroach upon the posterior inguinal wall. So the patient is having indirect hernia and this hernia encroach upon posterior inguinal wall. Posterior inguinal wall. Okay. Second type which is included here, it is indirect sliding or scrotal hernia. So second type which is included, that is indirect sliding or scrotal hernia. And the third type which is included, that is pantaloon hernia. What is pantaloon hernia? Pantaloon hernia is also known as combined hernia, in which there is simultaneous presence of both direct as well as indirect hernia. This is also known as saddlebag hernia, dual hernia, Romberg hernia. So pantaloon hernia, all these are included in 3B. What is included in type 3C? In type 3C, femoral hernia is included. So in type 3C, femoral hernia is included. Okay. And type 4 is for recurrent hernia, which is further divided into 4A, 4B, 4C, 4D. So see, type 4, this is for recurrent hernias. So it's for recurrent hernias. Clear? So what is type 4A? In type 4A, we are going to include the direct hernia. In type 4B, indirect hernia. In type 4C, it's the femoral hernia. And in type 4D, we include combined hernia. And all these are recurrent. Clear? So 4A is direct, 4B, 4C and 4D. Clear? So 4B is indirect, 4C is femoral hernia and 4D is the combined hernia. Clear? Combined hernia. Okay. So this is the Nyhus classification. So easy to remember. Type 1 indirect hernia with normal ring. Type 2 in which there is enlarged internal ring. Type 3A is direct hernia. 3B include indirect hernia encroaching upon the posterior inguinal wall, or there is indirect sliding or scrotal hernia or pantaloon hernia. 3C is femoral hernia, and 4 includes the recurrent hernia, which is divided into 4A, 4B, 4C, 4D.